Hello, my name is Dr. Shane Watt. I'm the treating doctor and chiropractic physician at Neurobolic Health Center. My office is located in South Jordan, Utah. Today, we're going to discuss peripheral neuropathy. Now, this is something that affects many Americans. It is not good. It really drastically affects how you are able to survive. Let me give you a quick example. I had a patient come in the other day. His low back was bothering him. That's why he came into my office. But he told me that he had just fractured his hip about 2 months prior to that. I'm like, what happened? So I wanted to get a little bit of history on it. He's like, well, I just missed my step coming out of a motorhome. And I looked at him and I said, you can't feel your feet, can you? He's like, what are you talking about? I'm like, you can't feel your feet. Oh, I can feel my feet. I don't have a problem with that. He was going off of his son, who is a surgeon, back surgeon, and has done multiple surgeries on him, how that his son had never said anything to him about that. I'm like, let me show you something. I did a couple of tests on his feet. It was remarkable. He could not even notice sensations when we were bending his toes, when we were putting vibrational instruments on his toes. He couldn't feel his feet. Now, why is that important? He fell, broke his hip, because his brain did not know where his feet were. $50,000 or more for that hip surgery. That's why I do this. We're going to discuss peripheral neuropathy and how I'm going to be able to help you. So, peripheral neuropathy. What is peripheral neuropathy? What causes it? What can be done to restore your peripheral nerves to your health? That's what we're going to go over today. Peripheral neuropathy. It is very common. It's affecting about 20 million Americans. That's a lot. Its electric wiring is breaking down in the feet and the hands normally, and we don't have proper communication from our feet or from our brain to our feet and our feet back to our brain. The brain cannot communicate. So what does peripheral neuropathy mean? Well, peripheral means further from the center of the body. Neuro means nerves, and pathy means abnormal. This is the general areas when you get it. You get it in the arms and you get it into the legs. Okay? 10 signs of peripheral neuropathy. You can have all 10 of these or part of these. Numbness, burning feet, cramping, sharp electrical pains in the legs or in the feet. Pain when walking, difficulty sleeping from leg discomfort, prickling, tingling feelings in the extremities, loss of balance or falling, weakness, and swelling. Those are the top 10 symptoms for peripheral neuropathy. This is the thing you need to understand. Your neurons are sick. Let me say that again. Your neurons are sick. When your neurons are sick, they don't communicate. When they don't communicate, bad things happen. Falls, surgeries, like what happened to the patient I was explaining earlier. That's what I am. I'm a neuron doctor. We're going to do everything we can to get your neurons back to proper health. These symptoms depend on multiple different factors. There's 3 different types of sensations. We have sensory, which is those that carry sensations is sensory. Those that control muscles are motor, and those that carry information to blood vessels are autonomic. So we have 3 different types of nerves sending messages and responding. Sensation changes. Damage to sensation fibers results in changes in sensation. That's when we get the burning sensation, the nerve pain. Neurons are sick, the nerve pain. Tingling or numbness, or the inability to determine joint position, which causes balance problems. If your joints aren't communicating properly to your brain, your feet don't know where they are. Your brain doesn't know where your feet are. That's not good. And how many of you are driving? For many neuropathies, sensation changes often begin in the feet and progress towards the center. They usually start more lateral and move more medial. Movement difficulties. Damage to the motor fibers interferes with the muscles coordination, so you can't move. You can't walk properly. You've seen how people kind of have to throw their feet. Okay? That is not good. Loss of dexterity, cramps. All these things are because of the motor function. Now, all chronic conditions have a lot of things in common. Chronic conditions are because of our metabolic issues. You probably never thought you couldn't feel your feet because of a metabolic problem. Well, peripheral neuropathy is just one of them. But thyroid, insulin resistance, diabetes, fibromyalgia, sciatica, hypertension, stenosis, IBS, insomnia, all these things a lot of times are linked together. In fact, I'm betting that you probably are really scared about things such as your memory, general health. All these things, it's not just peripheral neuropathy. You have a health condition, right? We're going to look at a lot of other symptoms and a lot of other systems than just your feet. A lot of these are metabolic imbalances. We have anemias, inflammation, blood sugar issues, adrenal issues, autoimmunes, food sensitivities. All these things make a difference. This is why you're not getting well, because you're just getting a prescription. I'm sorry, but you cannot get your body back to health by just taking medications. It does not work. Do me a favor. Think about this for a second. I want you to close your eyes, and I want you to think of 3 things, just 3 things that you can do to get your body healthy. So take 3 seconds. Now, open your eyes. Let me ask you a simple question. Did any one of you tell yourself, I need to take more medications? No. But yet, that's the answer that we always get. That's the answer that we go to, is the medications. I would highly doubt that any of you thought about, I need to take more medication. You probably thought about eat better, sleep better, exercise, all those common ones. Did you really think I need to take more meds? No, because you can't medicate your body back to health. All chronic illnesses are a combination of both neurologic and metabolic. Okay? It's very important that you understand that. You got to understand our metabolism, food, we eat food, it goes to energy. Food goes to energy. This is really basic, but food goes to energy. Now, 30% of our food and our energy, 30% of our energy goes to what system? What system do you think? The endocrine, digestive, nervous, immune, or cardiovascular? Well, the answer is our nervous system. 30% of all the energy that we need in our body to function goes to our nervous system. Well, think about it. Our nervous system ain't that big. We got our brain and our nerves. There's not that much mass. If you weigh 200 pounds, you probably have less than 10 pounds of that as mass that is the nervous system. But yet it requires 30% of our energy. So if you have a metabolic issue, it goes after this nervous system, right? Metabolic problems lead to peripheral neuropathy. We need proper metabolism for a well-functioning brain and nervous system. Leading causes of peripheral neuropathy. Now, I'm going to shock some of you, but the leading causes of peripheral neuropathy. Number 1, statin drugs. What's the statin drugs? Cholesterol. And you're like right now going, what? I didn't know cholesterol medications were bad. Yes, they are. In a really simple answer, they are bad for you. Leading cause, damage to back. So we can have some back issues because the low back nerves are what go down the legs. Arthritis, spinal stenosis, bulging disc. Diabetes, which is what? A metabolic condition or insulin resistance. Chronic inflammation from food sensitivities, inflammatory foods, hidden infections, poor omega-3s, which is your good fats, high insulin, hormone imbalances, and another one is chemotherapy. So, statin drugs. This is something that I'm probably going to irritate a few of you, but I'm telling you the truth. Statin drugs are not good for you. Now, legally, I cannot take you off any medication. I'm not a medical doctor. I don't want to be a medical doctor. I can't take you off of statin drugs, or any drugs for that matter. Now, the nice thing is most times when we are helping our patients, they're able to take themselves off or consult with their doctor. However, statin drugs are not good for you. They might be doing something for cholesterol, but cholesterol is the boogeyman. It is not the reason why you have problems. Statins inhibit the formation of cholesterol, right? And you're like, well, that's what it's supposed to do. My cholesterol is high. Here's our problem. Cholesterol is what makes up the sheath of the nerves. Cholesterol is also the building block of hormones. We need cholesterol. Cholesterol is important. Statin drugs inhibit the formation of CoQ10. CoQ10 is vital for our heart. CoQ10 is necessary for nerves to function. Statin drugs are also a leading cause of peripheral neuropathy. They also drastically affect vitamin D conversion. Vitamin D is for what? Health. We know that. We've learned more about vitamin D in the last 5 years than we had probably all the time before that. Statins increase the risk. There was a study from Neurology Journal in May 2002. So we're in 2014. We've known about this for a long time. So why are not the doctors, the medical doctors, doing this or educating you on this? Because they don't. They're behind on the science. 16 times greater chance to develop peripheral neuropathy because of statin drugs. So, have you been on a statin drug? And there's so many of them, who knows what all the names are. Have you been on a drug for cholesterol? Because if you have, that might be part of the reason why you're having the issues. So, cholesterol is not, this is the boogeyman. This goes back to this. I want to educate you on this. If cholesterol was the answer to heart disease, we should have answered that because we've been taking a lot of cholesterol medications. But since these medications have been coming out, our heart disease has gone up dramatically. Why do countries with chronically high cholesterol have lower heart disease than us? Why do just as many people with low cholesterol die from heart attacks as those with high cholesterol? Cholesterol is the boogeyman. There's no such thing as the boogeyman. Cholesterol is your body's trying to help create a healing environment. Okay, I'll get to that in just a second. Cholesterol will never clog your arteries unless you have inflammation, unless you are inflamed. That is the key answer. Unless you are inflamed. You need cholesterol for proper nerves and brain to function. Let me explain. This is based, all the medications are based on science from 60 years ago. There was a doctor that was doing some dissections, cut open some arteries and said, hey, what is that stuff? What's that goop? Well, they took it out, they analyzed it, it's cholesterol. He thought he found the answer to why arteries were getting clogged, why we're having heart disease. And thus, then they started developing drugs for those things. It's not the cholesterol. Yes, it was the cholesterol in that aspect, but the reason why you have the cholesterol is because your body tries to protect itself. When you have homocysteine and inflammation going through your arteries, it scratches them and it causes, which you probably have never thought about that, but it causes trauma to your blood vessels and your arteries. And so your body tries to protect it. It lays down a Band-Aid, and that Band-Aid is cholesterol. You wouldn't have a cholesterol issue if you didn't have inflammation. Inflammation is the key to your health problems in regards to cholesterol. Okay, damage to lower back. You can have stenosis, degeneration, bulging discs. Okay, those things can put irritation or pressure on the nerves. Those nerves travel down and affect those nerves from functioning. Here's kind of a common chart that we see with how the sciatic nerve comes down and all the other different nerves that we see. If we have damage in the low back, L3, L4, L5, S1 are usually the nerves that make up that sciatic nerve. So we do spinal decompression. We help to open up those nerves or those disc areas to help take pressure and irritation off those nerve roots so those nerves can then function better. Because if you're already unhealthy and you add now compression to those nerves, it just creates even a worse problem. Understood? Diabetes and insulin resistance. Okay, diabetes is a metabolic condition. Remember, what happens is we have what are called 1A afferent nerve fibers. They're large diameter nerve fibers. They're large. That's why they're called large diameter nerve fibers. They are more metabolically demanding than other nerves. Pain is a small diameter. That's why pain never shuts down. It's small diameter. These are light touch, vibration, those kind of sensations are large diameter. Well, when you have a metabolic issue, which is like what diabetes is and insulin resistance, they're more metabolically demanding. And when you have a metabolic problem, you're not able to get what needs to be gotten to those nerves, and so they start dying or reducing in their function. Does that make sense? So that is why we have loss of our ability to feel, or different sensations are abnormal. So the nerves need a lot of energy. Glucose is the nerve's source of energy. Insulin is the hormone that puts glucose in the nerve. It shovels it into the nerve, is what insulin is. When you are diabetic or insulin resistant, glucose can't adequately get into the nerves, and the nerves get fatigued. And if they get fatigued for too long, they start to die off. And that's why we have the numbness, the burning, the pain, and the tingling. You cannot build a house if that house is on fire. You've got to reduce that chronic inflammation. That's what we do with our patients. The reason we have so much success is because I'm not treating your peripheral neuropathy. You've already had that treated. They've already given you drugs that were never even made for peripheral neuropathy, but they discovered something with it, and so they still use them, which I think is absolutely wrong. But that's what happens. Most of the drugs you get prescribed are not for peripheral neuropathy. They were for other things, and then along the way they said, hey, this might help this too. But you cannot build a house if it's on fire. Inflammation means to ignite. You got to reduce that inflammation. How do we do this? Or what are some of the causes? Are food sensitivities. So we put you on what is basically a paleo diet. We got to get that digestive system reduced in the inflammation. Okay? Hidden gut infections, poor omega-3s, high insulin, hormone imbalances. We look at all these. We got to see what's going on in your system. If 80% of your immune system is in your gut, and your gut is very, very important to the health of your metabolic system, we got to fix the gut. I bet no other doctor has told you, oh, you know what, in order for us to help you, we got to work on your gut. No, they always go to the big toe. Well, we're going to go to that too, but we're going to do some other things along the way. Metabolic causes need to be addressed. Otherwise, you will never win the battle. We got to do some blood work. We do comprehensive blood work. Have you been told that your lab tests are normal? I don't agree with the ranges they use. We use what is called a functional range. Now, what that means is everybody knows that those are bad. Everybody knows that those are bad. That's outside the scope. The problem is if you're really close to the edge or really close to the edge, they don't do anything for you. We use what is called a functional range. And that is based on the Functional Endocrine Society. So we go off of that. So we have a solid idea of what the labs are. And we use those. Because how many of you, the doctor says, well, your lab tests are normal. It's like you have blood sugar of 125. Well, 126 is diabetic. So at 125, oh, nope, you're not there yet. Just do a couple of things and we should help that. They never tell you what to do. But they say, just eat a little bit better. Eat better grains and those things. Well, unfortunately, those are inflammatory, right? So we use the functional ranges. So glucose, we're looking for 85 to 110. In the traditional, it's between 65 and 110. Does that make sense? That's why you have issues, and yet the doctors a lot of times aren't doing anything for you because it's within normal limits. When you can't feel your feet, what happens to your brain? If you can't feel your feet, what happens to your brain? Now, you've probably never thought about that. But I can guarantee you, right now, a lot of you that are having issues with peripheral neuropathy are often having issues with memory, with digestion, with just can't function, brain fog, sexual dysfunction, all kinds of other things. It's not peripheral neuropathy that is the biggest problem. It's not the symptom. We got to go after the cause. What is causing that? Because if you're having metabolic issues affecting your feet, it's darn well affecting your brain. So, this is a study that was shown, and there showed a lot of similarities with people that had peripheral neuropathy, had loss of balance, memory issues, depression, anxiety, Alzheimer's, dementia, insomnia. Any of those ring a bell? Are any of those things that you're dealing with as well? Because once again, it's metabolic. We got to look at the metabolic activity. So here's what is called a somatotopic map. So this is of our brain. Okay, so this is inside our brain, a cross section. You have different areas of your brain have more information or more nerve fibers to your different peripheral activities of your body. Okay, like your thumb. Your thumb has actually one of the highest nerve inputs into your brain. All right, and this is just an example of that. So, what does a neuron need to revive and repair? It needs proper glucose, good glucose. I'm not talking Snickers bar. I'm talking good glucose. And it needs proper oxygen. You've got to have fuel. The fuel is glucose and oxygen. Now, we don't need inflammation. We need good neurotransmitters. We don't need inflammation. We got to reduce inflammation, get good fuel. The other thing is we got to do activity. We got to increase our activity. We got to fire those nerves. So we do specific things in our office with dietary changes to help metabolic activity as well as increase those nerves and get those things firing again. You got to get activation. You got to get activation. One of the things we use is what is called the HOCAmed. Now, right now, I'm the only one in Utah that has one of these machines. In fact, I'm the only one in probably about 2 or 3 states surrounding it. The HOCAmed is one of the, well, I'm going to tell you it's the best. Okay, my opinion is it is the best at helping with peripheral neuropathy. So not only do we do metabolic stuff, we got to do other things to help that, because that's why you came into my office. We got to get the reason why you came into my office doing better. So we use the HOCAmed. It is the Neurobolic Health Center, which is my office. It is the first clinic in Utah area to utilize the HOCAmed horizontal microcurrent therapy. Now, it's not the same as other electrical devices. You've probably already used those. They didn't work. Why? Because this stimulates the nerve electrically. It blocks pain. It improves blood flow. Stimulates the nerves biochemically. That's what the other ones don't do. They can stimulate electrically, but they don't change nerves biochemically. This allows for greater metabolism and healing. It reduces inflammation locally, and it's an alternating current. And that's why it's called horizontal therapy. And its consistent intensity allows for deeper penetration. So the difference is there are hundreds of different forms of electrical currents. All of these affect bioelectrical effects to the body. Horizontal electrical current is the only one that has biochemical effects and is the most state-of-the-art. That's why I got this machine. I got this because a colleague of mine in Chicago was introduced to this. I'm on a neurological board. And the nice thing is when you hire me to do work for you, you don't just get me, you get about 300 to 400 other doctors throughout the country. So this doctor, he got the HOCAmed, and he had been trying to deal with peripheral neuropathy for a lot of different things, for quite some time. and had had some success, but had never had really great success. Once he brought in the Hakamed to his clinic, it increased his ability to change people's lives dramatically. Now he's got several of them. And I attended a seminar that he gave. And that's the nice thing, is I'm always learning. I'm trying to do everything I can to get answers for patients such as yourself. So when peripheral neuropathy, peripheral nerves start to die, they need both types of stimulation. All those other things don't do it. The Hakamed's the only one, to my understanding, that does both, biochemical and bioelectrical. And we're the only one in Utah to do it. So what else is done for nerves to activate? Well, we do the Hakamed. We do vibration therapy. Once again, you got to have activation. So we do things to get your feet to be stimulated. We do oxygen therapy. Vibration stimulates the large sensory nerves in the foot while we're delivering oxygen to our body for healing. Okay, this is an example of what is called the rebuilder. We don't necessarily use the socks, we just use pads. However, we give you an home device. So we have the Hakamed, we do therapy in our office, and then we give you things for you to use at home. The rebuilder is a great device, but I've used the rebuilder in the past solely, and it gave me some results. But with the Hakamed, that's where we're getting the best results. And we're going to continue to get really good results for patients such as yourself. The rebuilder, once again, we give that to you. That's part of our program. We give you a home unit, so you can use it daily and you can use it after you're done with our program. We do things such as pain relieving creams. Okay, we use EFAC, which is very, very good to help with reduce inflammation and also reduce pain. Key points I want you to take home right now is it takes many different things to correct peripheral neuropathy. There's not a magic thing for it, but that's why we have success, because we are doing multiple things instead of just one. It's not just one thing. You must address the underlying conditions, which is the metabolic action. Okay, we do a really intensive dietary protocol because you've got to reduce the inflammation. We got to get you well. And not only are you going to get your peripheral neuropathy doing better, your brain's going to function better. You're going to feel better. I can guarantee that's going to happen. Why? When your metabolic activity is working properly, you will do better globally, all over. So our peripheral neuropathy program is the most comprehensive and state-of-the-art that exists in this state. And I'm going to say in all the states around us, because no one is doing what I am doing, with all the different therapies that we're doing, as well as the metabolic approach that we're taking. So in summary, comprehensive blood work. We also do an adrenal stress index test, and that's helped with our cortisol levels because that's inflammatory. We put you on an anti-inflammatory diet. You've got to be willing to make changes, because if you don't want to make changes, guess what? You're going to get the same old stuff. So you got to make changes. It's worth it, though. It is absolutely worth it. If we need to do spinal decompression, we do that as well. We do the Hakamed, we do vibration therapy, oxygen therapy, EFAC cream and supplementations. We do also nutritional compounds to help reduce inflammation, to get the blood system working properly. All those things are in a whole body approach. We don't just do one thing. We do multiple things to get you well. So, how bad are you? Well, we do an exam to find out. We got to see if you're really suffering with peripheral neuropathy. We do an exam to find out. It's called the Toronto scoring test. You should have 74. So if it ain't 74, if it's lower than that, we have issues, right? So, what's next? Well, this is on YouTube. This video is for patients who have not been able to come into the office yet, or a patient said, hey, I have a doctor that's helped me with this. You should look up his YouTube video. Well, the next thing you should do that from this point on, if it's ringing true to you, then you need to call our office and make an appointment. Either make an appointment for a workshop that we're going to do, or make an appointment for us to do an evaluation. So, a couple of things. Visit 1, we do a comprehensive neurological evaluation. We review your existing labs. We have you fill out some metabolic forms, some history information. You must bring your spouse, if you or significant other, if you're in that kind of relationship. You have to have somebody. Multiple reasons why. Number one, you got to have somebody on board with you. They got to be on board with the changes you're going to have to make. And we want to be upfront, ethical, and honest, so there's two people that know exactly what our approach is. Visit 2, we review everything. I explain what the plan, the program that we need to do. I give you the options of what care you want, and it's up to you to make a choice. What do you want to do? I'm not a used car salesman. I'm not here to try to convince you to do something, because I can't care more about your health than you. If you want my help, you're going to have to make the choice, the lifestyle changes, and make the commitment to get better. Now, something you need to understand. A lot of you are Medicare. You've already gotten what Medicare is giving you. Medicare is not going to give you anything more. Medicare's job is not to enhance your life. It's not to work on chronic conditions. It's not to change your function. In fact, in another presentation that I do on thyroid, I have a slide that explains exactly what Medicare does, which is pretty much nothing. So sorry to say this, but don't shoot the messenger. I'm just telling you the facts. If you want to get well, you're going to have to go outside the Medicare model. You're going to have to go outside the insurance model to get well. Because, let me just explain this to you. You've already been in that model. Are you well? No. So in order to do something different, you've got to do something different. So, we review financial obligations. Before you ever start care in my office, you're going to know exactly what it's cost, what you're going to get for it. Okay? And you must be with your spouse. So the first visit, you bring shorts and a t-shirt, because we're going to do a neurological evaluation. We got to see what the sensations are and how they're working. You got to have all your paperwork filled out. Once again, you must bring your spouse or significant other. Now, my normal neurological evaluation is over $300. But because you've watched this, a friend referred you to this, you've watched this on YouTube, you've come to my seminar, my workshop, we're going to do a discounted rate. My goal is to help you. So I want to reduce that fee to get you in so that you can have an idea and a vision of what we want to do, and you can see for yourself if you think I'm going to be able to help you. So, if you call my office from seeing this, it's a $75 fee. It's a lot different than the normal $329. But I wanted to be able to I want to reduce that fee, because I'm going to block out time, and I'm going to earn your trust and allow you to see what we can do to help you get feeling better. It's a commitment. Okay, you must be willing to make changes. You must take accountability for your health. It's not your doctor's fault. It's not your wife's fault, your husband's fault. It's not your insurance's fault. You got what you got because of issues going on with you. Now, with that being said, that's in the past. Let's look towards the future and see what we can do to help you so you can get better. Insurance isn't going to pay for this. It just doesn't. And if it does, it pays minimal. I'm not a Medicare provider for multiple reasons, but it might pay, your insurance might cover some of the chiropractic things that we do, but it's not going to cover the other things. Why? Because if they did, your doctor should have already been doing it, and it doesn't. We're going to get the results that we have to do, because I'm not worrying whether the insurance company is going to slap my wrist or not. When you hire me to do a job for you, my rear end is on the line. If you're writing me a check, my rear end's on the line. If Medicare's covering it, you don't care. I tried that, it didn't work. But it didn't bother me because Medicare covered it. You got to get back and become responsible for your own health. Now, we have payment plans, different things like that. But honestly, you got to be able to, realistically, you got to be able to afford between $300 and $400 a month. Why? Because what we do works. And it's going to take a little bit of time. It's going to be anywhere from 36 to 50 visits usually. It takes time. and I'm going to get you well. So, 6 things to think about. On a scale of 1 to 10, where are you? Because if you're a 5, don't call my office. You're not going to be willing to make a commitment to get well. I hate to say this, but you're not sick enough. Once you get sick enough, call my office, then we'll talk. Where do you see yourself in 3 years? Is it going to be better? Is it going to be worse? Are you going to make the changes you needed to make so it is better? How has it affected your life and your relationships, your work, your ability to enjoy life? Are you able to do the activities you like to do anymore? Or has it reduced what you've been able to do? Now, think of 3 things that you could do if you didn't have this peripheral neuropathy. Think about that. Maybe you might enjoy hiking more. Maybe it might be riding your bike. Maybe it might be swimming. I don't know. What are the things that you want to be able to regain and do again? On a scale of 1 to 10, how serious are you about eliminating your condition? So, how serious is your condition? How serious are you about making the changes, the commitment to getting yourself better? Because we know how to get you better. But I can't worry more about your health than you do. You've got to make that choice. You've got to be willing to make certain sacrifices, whether it's time, money, obligations, other things, your own dietary changes, all those things that happen. Now, due to time constraints, I can only accept so many peripheral neuropathy patients. I do a lot of different things. We help patients with thyroid, other metabolic conditions, and I am a regular chiropractor as well. So we can only allow for so many patients with peripheral neuropathy. So please, if you, on a scale of 1 to 10, are on those higher levels, and you want to get well, you want to truly get feeling better, please contact my office. Let's see what we can do to help you. If I don't think I'm going to help you, I'll let you know. Once again, if you're paying for my care, if you're writing a check to me, my rear end is on the line. I don't want to accept a patient that I don't think I'm going to be able to help. Medical doctors don't really care in the aspect of insurance is paying for it. Well, if you're going to pay me out of your own pocket, money you've worked hard to get, you expect results. Well, so do I. I'm only going to accept patients that I truly believe that I can help. I want to thank you for listening to this. I come across probably pretty passionate, and I am. I want you to know I care. I'm going to do everything possible to help you fulfill your healthcare needs, whatever they are. Some patients want a little bit of help. Some want a lot. Whatever you want to do, I'm on your side. I can't care more about your health than you do, but what I can do is offer you solutions, offer you answers, and offer you the ability to get these things changed, to get your life back, to get answers, to do what you want to do. My goal is to allow you ultimately to be able to enjoy the life the way you want to be able to enjoy it. Whether it's in serving others, whether it's just in regular working, whether it's going out and play catch with your kid or your grandkids, whatever it is, I want to have the results for you. Thank you so much for listening to this. Please pass this on if there's people you know that are suffering with this condition as well. Once again, I want to thank you. You can reach me at whatisupdoc@yahoo.com. Let me give you my phone number as well. It's 801-495-4444. Thank you so much. Have a great day.